today. This patient was actually denied surgery initially, and he has spinal cord compression, he has spinal nerve compression, he has severe weakness, and he has a collapsed neck. So these are the challenges that we have every day. So to get patients to the OR takes a lot of people, and I'm grateful to every one of them in my office. Dolores and Linda, my administrator, my scheduler. Dolores is my scheduler, Linda's our administrator. So I'm grateful to them for continuing to battle so that we can get our patients taken care of. But we battle this all the time. A patient who has a clear indication for surgery, denied by the insurance company. First they denied the surgery altogether, then they said that I couldn't use cages to support the spine, then they said I could do a 3-level fusion without a plate, then they said the patient had to go home the same day of surgery, which I think is actually dangerous. So for me, I'm always thinking about what's the safest thing for our patients to do, and I don't want to send my patients home after a 3-level fusion of the neck, because you can have a hematoma or bleeding build up under the breathing area, compromised breathing, and if you're at home, you're not going to get, EMS won't get to you soon enough. So I don't like the idea of sending patients home. So that's a challenge that I always have. And so we're going to take care of this patient. We're going to see how he does after surgery, and I'm going to do what's right for my patient and keep him safe.
There's nothing worse than to be standing in a hospital and your loved one, for me, my father and my son, and there's a medical emergency, and you're sitting there talking to somebody about insurance. Or a doctor can't do something because the insurance company said they can't. There's nothing worse than that. And as I get older and I understand more about this process, and I've been in that dark hospital hallway a few times now, it is absolute insanity. And we're going to take a look at this in these videos. I want to get your comments down below, your experiences, so we can all learn from each other. But this is wild. Healthcare in America is insanity. And it just frustrates me so much.
I feel like only in America can you need medical assistance that you can't afford to get. And in order to get government help, you have to make under a certain amount. So if you're someone who's like makes $60,000 a year, you don't qualify for any fucking help, but you can't actually afford to get your child the services that they fucking need. But if I quit my job and I go work for McDonald's, I can live off the government, and then she can have the help that she needs. Make it make sense. Make it make sense.
There just needs to be a lot more questions about this. You need to call your politicians, your local senators, your representatives, and say, fix this. They could do it. They don't want to. That's the problem with a lot of the things we argue about, in politics, is no politician wants to put their name on the bill and say, I was the one that put this on the floor. And then they all had to register whether they voted yes for it or no for it. In their career, they don't want that label. And that's why a lot of stuff never gets fixed. They can fix 99% of these things in a day on Capitol Hill. But instead, they want to slide pork into the bill. They want to put this in the bill for their buddy. They want to do all these things, and it comes out this thick, and nobody even read it. You gotta get rid of these career politicians.
Oh, you want free healthcare? Well, I hope you're ready to wait a very long time to see a specialist. Okay, well, I don't have free healthcare. I live in America. We just tried to schedule an appointment to see a neurologist for my husband, and there was a 4-month wait. Wait, there's more. I'm leaving my full-time job at the end of January and will be working as a 1099, so that means I need to get our health insurance on the marketplace. So let's see what that looks like, shall we? After I put in all the information for my family, which is 2 adults, me and my husband, and our 3 young kids, 2, 4, and 6, all of whom are healthy with no underlying health condition, which honestly should not matter, but of course it does in America. Let me tell you about the plans that are available to me on the marketplace. Better yet, let me show you. So here are the plans available to me. So cheapest one is $7.58 per month. And we scroll down and it gets progressively more expensive for your monthly premium. So let's go over the cheapest option. Okay, so my monthly payment would be $758.04 just to make sure that I have health insurance. That's $9,096 per year that we will spend no matter what, even if nobody in my family ever sees a doctor. But then, wait, let's get into the deductible. Deductible is $6,000 for each individual person and $12,000 for the family. This is the amount that we would have to pay out of pocket before any of our expenses get covered, except for preventative care. Wait, there's more. So let's just say, God forbid, we need to end up using our entire deductible. Who knows what happened? God forbid we actually have to use our insurance. After spending the monthly premium and the deductible, which would equal to $21,000 that year, there's still a 50% co-insurance after you've already met your deductible. Let me show you. This would be anything from lab services, other professional services, x-ray and diagnostic imaging, and you better stay in network because if you go out of network, you're going to be paying 100% coinsurance. Same goes for medications. Personal favorite, 30% coinsurance after deductible for delivery and all inpatient services for maternity. Hey, you already spent $21,000 this year on healthcare and now you decided to have a baby. You met your deductible, but you're still going to have to pay more. It's a good thing we're done having kids. If you're an American...
You know, there's also this crazy line of when you get the bill from the hospital and you're like, oh my gosh, they charge that much for aspirin or that much for a bandage or that much for a scan. And then you see the cash version and then you see the healthcare amount, like with health insurance. And you're just like, so which is it? You know, like why is it one cost and then it's another? And then once the insurance company banners back, it's another cost. There are so many questions of how is this not getting reformed? And then if you've got to call the insurance company, you know, that takes forever. You get transferred and transferred and transferred. Or that you didn't bring your healthcare card in the emergency. You know, like, now what? And then they send you the bill and then you've got to argue it in the arrears and you just don't know what to do. And for somebody like me, like I never understood my insurance for a very long time and I had to dive into it at the worst possible times. So stressful. And then when they tried to kick my dad out of the hospital while he was laying there dying, and I knew the moment they put him out of the hospital, he was going to die. And we all knew, even the doctor said he's going to die, but we have to take him out of there. And after me threatening to sue everybody, they left him there and come to find out he needed to stay there. But that doctor and that nurse, and they wouldn't answer any of our questions. It was the worst experience ever. And I know they're overworked too, and they're stressed, and they're dealing with the same healthcare or the same insurance companies. But something has to be changed that, you know, if you're going in there for a basic emergency, like the government should be able to pick that up with the amount of taxes we pay. What they spent on all those bombs overseas and deploying all those soldiers, I used to see the bills for this, the amount of money they spent. They could have provided health care for everybody and still done that war if they would have just done that war for half the price because they didn't need to pay $10,000 for a toilet seat, you know, and then leave it all over there and then it got scrapped and sold. Don't get me started on that stuff. We could just spend this money so much wiser. And we're seeing with all these audits that there's so much fraud, waste, and abuse in the system. It is crazy.
We dropped our health insurance in 2025. We have so far made it 2 days without health insurance and we have survived. We were spending so much monthly for our family of 7 to have health insurance. And then we were still spending an astronomical amount on copays and medications and urgent care visits and doctor's visits that it just did not make sense. So what we decided to do is we're going to take this 1 year and we're going to drop our health insurance. Instead, we are putting the money that would have been taken out for health insurance in a health savings account. And we will be doing cash pay this year. Now, we aren't completely crazy. We did keep catastrophic and a couple of other smaller insurances along with dental and vision, but we are going to be paying about $40 a paycheck now versus the $600 a paycheck that we were paying before.
Statistically, one of the quickest ways to go bankrupt is to not have health insurance. And I see she said she's going to keep catastrophic. Cool. But statistically, it is not smart to not have health insurance, especially if you have any type of ailment or you're cancer prone. The cost for cancer treatment is baffling. The cost for heart treatment, baffling. The cost for any type of event where you have to have lots of tests run, those tests are bafflingly expensive. They have you. It costs so much for health insurance or for healthcare in America that they have you handcuffed to the healthcare system. And as you get older, it gets worse. And, you know, going through this with my mom that, you know, she's of the age to retire. And then her biggest fear, once she had her check in her hand every month, was, what am I going to do if I get sick? And you shouldn't have to live in retirement with what am I going to do if I get sick? And then have supplements on supplements that eat up your standard of living and your basic check you receive every month. It's scary.
One of these health insurances. If you have one of these health insurances in the US, you're being scammed. That's because all health insurance in the United States of America is a scam. Because if you're like most people that live in the US, every month you're paying these premiums, which means you're paying for your health insurance. They make it seem like it's a good thing because you're paying the pre-tax amount. But here's the thing, even if you go to the doctor, 9 times out of 10, you still have a copay, or you're going to have to actually pay for the entire cost until you reach your deductible. And if you're entirely healthy and you never use your health insurance, cool, you're still paying your premiums. But surely if you don't use it the entire year, you probably get like a refund or something, right? No. Because this is the United States of America, where health insurance is a scam. And let's say you get a bill that is too expensive for you, so you can't pay it, and you just decide not to pay it. What happens? You go to collections, and then your credit score drops, which then means you're going to struggle to get a new car, or get approved for a new apartment, or get a house. And here's the thing, is on paper, right? On paper, health insurance and your credit score, they never cross. On paper, they never intertwine. They are two separate things. But in the great United States of America, we know that they are intertwined, and millions of people are impacted by this every single day.
What do you have to say about that in the comments down below, especially if you're in the insurance world? You know, insurance is a for-profit thing. And man, I have a hard time like rationalizing healthcare and for-profit. And I know like to pay doctors and have, you know, specialty healthcare workers, you have to pay them what they're needed. And I know the whole idea of the socialistic medicine, that doesn't work either, because in many situations, especially for small practices and the way we've structured healthcare, it can't be unwound and recreated and any type of orderly future. Like you can't destroy it all in one day and expect it to go back together and the way we've built our society. We're kind of going down this road and there's no stopping it. But for a child or an old person to sit there and suffer because our system is so rank when you go to the hospital, and it's such a scary thought of, oh, my kid's hurt, how much is this going to cost me? Like, that is a terrible feeling. And that basic things, like you get your arm broke, they fix it with some type of common sense parameter. And I know a lot of people clog up the emergency rooms to get pharmaceuticals and to get it. There's just so many things there that I don't have the answers for, but I know there needs to be an answer. And it's not something that a guy on the internet can solve. But if professionals and politicians could get there and actually not be corrupt and try to fix it, it would be great, because these things need to be fixed. I want to hear what you guys got to think about this. This is something I'm passionate about because I just dealt with it with my father, and I'll see you guys on the next video. I wish I had more to give to this video, but this is not a topic that I know a lot about, but I know there's somebody out there in the comment section that does. I'll see you guys later.
If you